Welcome to today's edition of Ideke Moments. In today's edition, we are going to measure again on prostate fictions and prostate facts. Prostate fictions and prostate facts. This now is part 2. It is a part of our series which we choose to title Health Fictions and Health Facts. This one is now volume 1, number 2. Volume 1, number 2. I will talk a little bit about myself for the start. My name is Dr. Ignatius O. Honor. I am a pharmacist, a nutritionist, and a naturopathic doctor. I am about 70 years old. I've been a pharmacist for 41 years now, graduating from University of Nigeria in 1979. I am also a trained nutritionist and a naturopathic doctor. That's what I normally talk about it, a doctor that majors exclusively on the use, deployment of natural product and natural food in order to achieve cure, permanent cure for almost everything on planet Earth. That is what I am. Today's edition, again, I said, is prostate friction and prostate facts. You remember, last time we measured on 3 or 4 aspects. I will recall it. That was real definition of prostate disease, real symptoms of prostate disease, real causes of prostate disease. We did that in part 1. We also announced up front that during this second one, which is part 2 now, we are going to demolish a number of fallacies which we have to do in order to clear the road for the facts to come in. As we normally ask, why do we insist on demolishing fiction before facts? I will tell you again, it is 10 times more difficult to unlearn an error than it is to learn one single fact. It is Dr. Mike Murdoch that said it, and I agree with him totally. So today's edition, we are going to deal with demolishing those fallacies, those fictions. And what are they? What are they? PSA screening tests, prostate biopsy tests, prostate drug treatments, that is alpha blockers, 5-alpha reductase inhibitors, even natural products. We're going to deal and discuss this and find out and tell you why what you have been told about them are no longer what is going to be. We start with the first one now, which is prostate specific antigen test, PSA test. What really does PSA test mean? What does it measure? I will tell you. The urologists, which are doctors that major on the urinary tract, especially the prostate in men, urologists tell us that PSA analyzes your blood for prostate-specific antigen called PSA, which is a substance produced by your prostate glands. They also tell us further, when higher than normal PSA level occurs or was detected in your blood, it is believed, mark the word, it is believed that cancer may be present. It is believed that cancer may be present. This is very important now. What does higher than normal mean? What does higher than normal? What is the normal? To start with in the first case. Is this test still credible? Is it still being defended by the people who started it? The answer is no. And I'll give you 1 or 2 authorities that were supporting it before that are now saying no, PSA test is no longer credible. The first I will mention is an authority called USPSTF, which is the acronym for United States Preventive Services Task Force. Who are they? This is an organization that measures and finalizes and regulates all medical testing in the United States and by inference globally. For instance, these are the people who formulated malaria test measurement, typhoid test measurement, cholesterol, and almost all other ones. And they are so important that they fashion and regulate and bring out an addendum to whatever they did every 5 years. Just imagine what they said about PSA test in 2012. I'm quoting them now. We are not recommending PSA test for any man of any age anymore. We are not. This is their own word. Number 2, they say, we recommend that doctors and patients do not screen for prostate cancer because the potential benefits do not outweigh the harms. The potential benefits do not outweigh harm. Why did these people say that? Because it's very remarkable. When this thing was invented in 1994 or so, they were the people that brought it out, advertised it, and showed the world the numbers to use. And they have been repeating this every 5 years until just 2012. What did they see? What did they observe? Why did they change their recommendation? I will tell you, again quoting them very profusely. They said, if you get PSA test for prostate cancer, you are 80 times more likely to get unnecessary surgery or radiation than you are to have your life improved. Number 2, prostate testing is unreliable at best and useless at worst for accurately diagnosing prostate cancer because PSA levels fluctuate for a variety of reasons. One being age, which causes PSA level to grow. Another one, there's yet another one. Another condemnation by somebody who should know. In fact, it's like hearing from the horse's mouth. I am talking of no other person but Professor Richard Ablin, PhD, who invented PSC in 1970. Look at him and look at his book. The title of that book is very self-explanatory. He said, The Great Prostate Hoax. How big medicine hijacked the PSA test and caused a public health disaster. Yeah, that man discovered PSA, not the test. He discovered PSA in 1970, which is a molecule attached, which is produced by the prostate. It's not a disease, really. Let us hear some full revelation. The test is hardly more effective than a coin toss. Number 2, PSA testing cannot detect prostate cancer. Number 3, it can't distinguish between the 2 types of prostate cancer. Number 4, the test simply reveals how much the prostate antigen a man has in his blood. It continues. Infections, over-the-counter drugs like ibuprofen and benign swelling of the prostate can also elevate a man's PSA level. But none of these factors signals cancer. Men with low reading might still harbor dangerous cancers, while those with high readings might be completely healthy. Problem with PSA test is that there are too many false negatives, up to 80% false negatives. That when it gives you positive, it's still wrong. We don't want to say any other thing about PSA test. You have heard it. We go quickly to the second assumption for today, which is what? Prostate biopsy test. What does it even mean? Hear me now. According to urologists, I told you it is doctors that measure on urinary tract, especially the prostate. The urologist says that is a procedure to remove samples of suspicious tissue from the prostate. They continue. During this prostate biopsy, a needle is used to collect a number of tissue samples from the prostate gland. I will interpret it to you now. To collect tissue means to jab out flesh from a living person's prostate gland. It is a very a very laborious process, is a harmful one, and many other things. Why are experts now kicking against biopsy? There are two major reasons for that. One is because without going through the PSA and recognizing it, the prostate biopsy will not come up. In fact, it's like one bad test leading to another. Why am I saying it? Look at me very well now. Because biopsy follows PSA test just as day follows the night. Without this one will not come. And we have agreed comprehensively that PSA test should not be done. So that means also this one should not come up at all. That should even settle it, but there's even a more cogent reason why this one should not be done at all. I will tell you, these are the side effects. Bleeding at the biopsy site, rectal bleeding is common. Blood in the semen, blood in your urine, difficulty urinating. Prostate biopsy can cause difficult urination. Infections. Men who have this have lots of infection in many parts of their urinary system because of germs that are communicated during that invasive process. All these ordeals for what is considered even a useless venture. Is it worth the effort? But this is not even the only fallacy we have to discuss today. We have to go to the next one, which are the drugs that are used for treating or managing, as we call it, BP, which is benign prostate hyperplasia. There are 3 of them, and they include alpha blockers. They include 5-alpha reductive inhibitors, which is called 5-SARI by professionals, and also even natural products that are used to manage prostate disease. We're going to talk about 3 of them. We go straight to the first one, which is alpha blockers. Alpha blockers. How do they really work? How do they really work? The urologists tell us again that these drugs treat BPH or enlarged prostate by relaxing the smooth muscles in the bladder and prostate and making it easier to urinate. They tell us openly, unabashedly, that this drug do not shrink the prostate gland. But are they harmless? Far from it. Because in addition to relaxing the prostate and maybe even the bladder, they relax all alpha smooth muscles all over the body. All. And these smooth muscles prefer to be strict. They prefer to be taut. They prefer to be strong, not relaxed. And they are there everywhere in the brain, everywhere in the eye, in the heart, wherever. Where being relaxed is against the original job they are created to do. That is why we're not surprised that all these side effects are occasioned by alpha blockers, which nobody budgeted it when he was taking it. And where are they? I will tell you. They lower your blood pressure precipitously. They make you feel very tired. They cause dizziness, faintful headache, lightheadedness. They cause extreme low blood pressure. They give you retrograde ejaculation. Retrograde ejaculation. I will talk about it very well. Because it's a disaster, it's a humiliating thing to any man. Retrograde ejaculation is that a stage that the sperm was supposed to be emitted. It goes back to the bladder. Because there was no pressure to bring it out. The relaxation has caused the body what he knew how to ejaculate. This thing goes back not just in the right position, but the bladder. Because there are now content that were supposed to go out that shouldn't even enter the bladder. Because there are ingredients that were given by the prostate gland that shouldn't go back. When it goes back to that place, it becomes a disaster. Let us go to the second BPH drug, which we told you it is called 5-alpha reductase inhibitors. 5-alpha reductase inhibitors. We, the professionals, call it 5-ARI. How do they work? There are 2 major ones, as a matter of fact. two major ones as a matter of fact, and we call it finasteride and dutasteride. Finasteride and dutasteride is like brother and sister or two sisters. How do they work? How did these 5 R's work? The urologists tell us again, and we take it because they are experts in it. They say they reduce production of androgen, hereby shrinking the enlarged prostate. They also say because it is speculated that high levels of this androgen may promote prostate enlargement. So they want to reduce it everywhere. But look at me now. At what cost are they doing it? At what cost are you reducing what is supplying the body every other in other places? Just because it may reduce prostate swelling. You know why it is dangerous? I will tell you. Because the androgen that is being reduced, which actually means suppressing it, incapacitating it, including testosterone, which is the hormone that makes a man. It's a hormone that determines everything that happens in the body of a man, including ejaculation, including fertility and other things. So any wonder then that when this hormone is paralyzed or incapacitated, we're going to see a lot of harms in the person's body. You should not be surprised. Just look at the side effect of this 5 SARI and you know what we're talking about. They are erectile dysfunction. They are lower sex drive. Again, our enemy here. Retrograde ejaculation. The other one did it. This one is also doing it. Yet, some people take 2 of them at the same time. A very grievous thing. So, are you now surprised that most of the people who take this also cannot be fertile? They talk of low libido, they talk of weak erection, they talk of premature ejaculation. These things, the drugs are promoting them. Inadvertently, they are rendering the person much more sicker, much more incapacitated, even as we are not sure they are doing anything to the targeted item, which is the prostate gland. This is very, very important. But this is not even the only havoc that these 5 R's rock on the people who are using it. There's another one, a more deadly situation. Look at it now. They promote diabetes and other cardiovascular disorders in people who use the drug. There are hundreds of researches and accomplished conclusions that gave rise to this. I will just discuss 2 with you. One from the United States of America, and I quote it correctly. We found that men being treated with dutasteride and finasteride for benign prostate hyperplasia have roughly 30% increased risk of developing diabetes. This is from the University of California, Los Angeles, School of Pharmacy. The second one from the United Kingdom. I quote again. We discovered that this commonly used prescribed medication for prostate cancer, that is dutasteride and finasteride, can greatly increase the risk of type 2 diabetes. This one is from the British Heart Association Center for Cardiovascular Science at the University of Edinburgh. So you will be wondering, why does 5-ARI do this? Why does it cause this havoc on people? I will tell you. Those people also tell us why. They said these drugs reduce the body's response to insulin. It reduces the body's response to insulin. That means that it encourages insulin resistance. Recall that in the first part of this our discussion last time, we mentioned insulin resistance as a chief culprit that cultivates prostate enlargement among many other things it does, like diabetes and many other things it does. So you can now see any drug that promotes insulin resistance has added salt to injury. As we promised in our last edition, in a moment we'll run a series on insulin resistance because it is very vital, important for everyone to factor this insulin resistance in his medicine and his nutrition. The last one we're going to talk about is herbal product, medicinal product that are used to manage, quote and unquote, prostate disease. I want to make a point of clarity. I am not saying that medicinal product don't work. I am a product of medicinal product. I started collecting herbs at the age of 10 for my grandfather. And I've been a pharmacist for 41 years. About half of pharmacy then and now is still natural product. But I am saying the present one we're using and talking about for prostate management do not go far because they do not understand what is causing the prostate. What they also claim is to relax. I say relax. Relax the prostate passages or relax the bladder so that the person will urinate freely for some time. All other things that make this work, that thing, they do not know it at all. So that is why nobody should use it and say that they're doing anybody who is doing any claim about it will also have to give somebody that drug for life, which is not what we're talking about. When you are talking of cure, it's different for that. So we have established that all these fallacies have removed now. Now, it's time to go to the main dish, which is how to cure prostate disease. And do that comprehensively. And do that finally. And also do it together with some other accompanying diseases and disorders that go around because nobody really has prostate alone. So that is what we are going to measure. And as we're going to do it, we are going to unfold several ways we do it, especially the dietary component, which is normally up to 60 to 70% of our treatment. Naturopathic medicine. We also tell you the herbal product that go to the cause and solve it. Of course, we are not going to forget some lifestyle adjustment protocols, which also goes to make the individual healthy. We give you this in buckets and buckets and handle it and hand it over to you. But this has to come another time. So we advise you to stay tuned to the community because a little learning is dangerous. That is what Alexander says. So subscribe to Ideka Moment and you shall never be disappointed. Ideka Moment, no more and live better. No more and live longer. I remain your host, Dr. Ignatius O. Honor.